our special session. This is Revolutionizing Healthcare Insurance CX, customer experience. And this is really going to give you some practical tips around the strategies to drive growth, loyalty, and transformation. And of course, Paul, you're very welcome. Thank you so much for taking time. Always wonderful to see you. It might be useful. I know you're held the seat of the Chief Customer Officer for a number of really well-respected healthcare insurance companies, but it might be useful for a guest just to get a quick overview of your experience.
Sure. Good morning, Chris. It's really good to see you as well. I've been looking forward to this time where we can just, you and I have a discussion. I'd love to even start with, early in my career, always focusing my efforts and focusing through the lens of the consumer. Started my career in earnest in airlines, and so being able to being able to build the first booking engine. So if you recall, we used to have to like mail tickets out, or we would have to go to a city ticket office to actually like get a ticket. But building that first booking engine to be more transparent about how the airlines sell their tickets and getting on the airlines. Um, uh, um, Filtered that into loyalty programs and helping people earn currency toward new and exciting kind of opportunities for them, whether that was free flights or travel or even a new car. Um, Throughout all of that, there was this thread of this customer experience, which is
Yes.
really, super important. And I often found that businesses would think about the loyalty program that they were delivering as sort of that be all end all of the customer experience, when in fact it's that end to end experience and being transparent and understanding who your consumers are and what they're kind of dealing with throughout the various stages of their life with you and your company. Learned a lot about customer experience through my time earlier in my career, and left and wanted to really change the way that companies deliver their experience, and of course landed on healthcare, which is such a challenging industry. And I've been with healthcare for the last 15 years. I've held the roles of VP of Enterprise Customer Experience, Chief Experience Officer for some of the largest health plans and healthcare delivery systems in the world. So it's good to be here today with you and to talk a little bit about my learnings and how to maybe apply that across whether it's different industries. I don't know who we have joining us today, but whether it's different industries or really just in healthcare.
Yeah, and I think the big reflection, the big idea, maybe want to start there, Paul. Obviously, your deep experience in uh, strategy and C-level gives you a different perspective on the industry and some of the challenges. Would it be useful just to kind of frame the problem that, as you see it, in terms of the opportunity for how customer experience can be a real transformational driver for healthcare? So I think it might be useful for our audience just to kind of frame up where you see the big challenge, as we call it, the quadruple challenge presented.
Yeah, well, for those who have been in healthcare, and again, I even think this can apply to other industries as well. But for those who have been in healthcare, they should know about the quadruple aim, right? And that is increasing a patient's access to care. That's number one. Number two is to drive better outcomes. We're going to talk about that problem today and what it actually looks like. The third one is to lower the overall cost of care. And right now, that's actually going in the opposite direction. And then lastly, improve the experience that patients and providers have as they interact with the healthcare system. And I actually think about it a little bit like early in the 1900s, there was a phenomenon called the chauffeur problem. And I actually think about it more in terms of a chauffeur paradox. So in the early 1900s, that's when the automobile was, uh, presented to the market, so to speak. And the only people that could actually afford the automobile were wealthy people, or
Yeah.
manor owners or landowners.
Mhm.
And so they would purchase the automobiles, and they would use them as sort of joyriding, and they would use them as sort of a Sunday kind of enjoyable activity. But they didn't know how to drive them. And so they put in charge of their automobiles the stable hand. So someone on their staff that was managing the horses and the carriages, which seemed to sort of stood to reason, because it was similar, like a horse and carriage. It just didn't have the carriage; it had an engine instead. Well, these stable hands became the chauffeur of these automobiles, and they would drive their bosses around on a Sunday afternoon, or just for joy rides. Um, uh, and so what ended up happening is these stable hands started to build a lot of power. Um, they were the only ones that knew how to operate them. Uh, as I mentioned, the landowners didn't know how to operate them. They were the only ones that knew how to fix them. In fact, they were really challenging to fix. They were, the chauffeurs would literally have to like carry um, foil and asbestos and wrenches and oil and hammers, and a huge chest that would have to be put in the back just to maintain it in case it was, broke down on the road. They literally had to change the oil every single week. Can you imagine? So they started to then sort of wield this power, because they were the only ones that knew how to drive it. They were the only ones that knew how to fix it. And they figured out places where they would store them. So what ended up happening was they started to um, create partnerships outside of their bosses with people who would store the vehicles, and they would scrape money off the top, or they would use the vehicles for their own enjoyment, or even make money. And they would act as if the vehicles were their own vehicles, and they would drive them around as if it were their own, and they would make money on the side. And so that was the chauffeur problem. Now, the chauffeur paradox is somewhat in terms of uh, when the technology of the automobile became simpler, and when it became more ubiquitous that other people would own the vehicles, would be able to own the vehicles and maintain them themselves, the chauffeur's power and the need for the chauffeur greatly diminished. And so the chauffeur then had to reinvent themselves. So the idea of technological innovation and declining costs collide with consumer demands for simplicity and transparency, that veil of the chauffeur paradox between the chauffeur, or the person who's providing the service, and the person who's wanting the service, that veil gets lifted, and an overall better experience will be developed. That's what the chauffeur had to deal with. And so they had to then start to transform themselves, and they turned into mechanics, as an example, and they would open mechanic shops. They were the same type of person, right? So they were, we were dealing with mechanics that maybe were less than honest, and then that turned into actually car dealers. And we all know, in the early, let's say, 80s, or you think of the Jerry Lundegaards, of the movie Fargo, who were kind of a little nefarious as it related to being an auto dealer. Now, I will say that auto dealers have had a huge transformation in the way that they deliver service and sales. It's almost much more like an Apple experience, because when technological innovation and declining costs collide with those consumer demands for simplicity and transparency, that veil of the chauffeur paradox gets lifted. And we're seeing that all over the place. We see it in, as an example, um, the telephone, right? We used to have operators between you and me to actually have to make a phone call, or cameras. We used to have to send our film in or know how to walk into a dark room and develop our film, or computers. We used to have big, huge rooms, and only a few people really knew how to run those computers. All of those have transformed into today's smartphone, right? We can take pictures very easily, and they're instantaneous. We can actually, instead of having a phone chat, we can actually have a video chat like the way we're doing right now. And the computer itself is, in our pockets. It's that simple. Um, so here's the problem with healthcare, right? And you and I have talked a little bit about
Yes.
this. It is still suffering from the chauffeur paradox.
Mm.
There is a veil between you and me, right? If you are the consumer or the patient, and I am the health system or the health insurance provider, it is incredibly confusing and incredibly hard to understand. And there's more problems with that too, as we know, Chris. So that's sort of that's the problem I think that we want to talk about today.
Yeah.
And maybe talk a little bit through like how to build better transparency, and how to, again, help patients increase their access to care, drive better outcomes, lower the cost of care, and improve the experience.
I love that. Such an elegant way to kind of introduce us to, I suppose, a reframe in terms of how we think about the healthcare, which is ultimately thinking about how do you pierce the veil, how do you lift the veil to add that transparency. But I also detected, Paul, that you were also suggesting that there's been a power shift almost between, customers potentially voting with their feet, but actually opportunity for disruptors within healthcare who are really giving this level of transparency and better customer experience. So maybe that's the problem. Where do you start? Like this is uh, several decades old in terms of trying to work
Sure.
through these challenges. And what's the cost implication of how they're trying to do that today? I know you had a reflection on patient outcomes as it relates to spend as well.
Absolutely, yeah. So I think we have a chart. Might be good to bring up a chart as we think about really stating the problem specific to healthcare. And so, what we have is, um, since 2012, and I could have gone back all the way to 1985 on this, right? But since 2012, we've had major rising costs in healthcare, from just under 3 trillion to, in 2025, it's estimated that it'll be about 5.4 trillion. And by the way, that cost metric is only CMS costs.
Oh,
It is only the Center for Medicare and Medicaid Services costs in the United States that I'm talking about. It does not include commercial healthcare costs. So if insurance companies are supporting commercial members, or if a company is self-insuring their employees, that is not included in those costs. It's just the Center for Medicare and Medicaid Services.
yeah.
And at the same time, outcomes are dropping, meaning, what we're looking at here is the trend of Americans with no chronic conditions. This is this is startling to me, that just over 36% of adults are not suffering from any chronic conditions. And it's also well known that when Americans are suffering from one, it's more likely that they're suffering from more than one. They're suffering from two. So here you have this, if you think about the quadruple aim, right? Lower costs, not happening. You think about driving outcomes, not happening. Americans are getting sicker. And so this is the problem that we need to deal with. And I think that experience plays a huge part in this. I actually think it could be sort of the lasso in between the cost and the outcomes to start to pull and start to bend the outcomes curve and start to bend the cost curve.
And of course, that's great news for all our customer experience professional listening, that actually, the opportunity for CX professionals to come to the table essentially with a fairly disruptive perspective about how do we achieve cost and outcome balance. So I think that is quite a startling and arresting chart there, Paul, in terms of framing the challenge. Um, do you see that trend continuing, and, before we get into, well, how do you reimagine, do you see changes happening that is actually going to facilitate this, or are you seeing good examples of, where good outcomes that relate to costs are being delivered?
Well, without a major disruption, it will be really, really difficult. I actually do think that the customer experience is a burning platform that will assist. Um, I think what included in that, just going back to the chauffeur paradox, right? There needs to be more transparency. There needs to be a stronger focus on helping members get the care that they need prior to them actually getting sick. So focusing more um, on health care rather than on sick care, which is mostly what the United States is sort of centered around as it relates to healthcare and the healthcare systems. There are definitely some drivers to this. So I think that it is ripe for disruption. We can't sustain a $5.4 trillion healthcare costs on a yearly basis. Um, as Americans continue to suffer from more chronic conditions, we are going to be dealing with major challenges in employment, major challenges in overall uh, uh, the need to like meet the needs of what our country is set up to do and to establish to do. So those are the drivers that are going to, I think, lift the veil of the chauffeur paradox.
Sure thing. It feels that that's quite a seismic shift here. We're talking about full system change, almost turning around the tanker ship. And of course, we've seen this in other countries, transformations to re-engineer the NHS, for example, within the UK. And also, I know other private healthcare countries like Australia, in terms of really putting patient experience at the heart of what they're doing, this idea of value-centered care as well. I also
Absolutely.
note your point on wellness and actually the role for insurance companies to shift their paradigm for prevention and obviously reducing premiums and increasing better outcomes as well. Would it be useful for any other further reflections, Paul, just before we then say, well, what's the linking kind of chapter that gets us to a way in which we could start to think about the strategies to actually make some of those changes?
Well, I do want to say, I think there's a lot of focus on, building trust
Yeah.
in, with patients and with members, and I think that there's a lot of finger pointing
Mm.
as it relates to that. And I want to sort of dispel that, right? So, I could be at a conference or something, and I can hear things like the doctors need to do a better job of building trust with the patients. I don't think that's the problem that we're trying to solve. I think we need to provide the doctors the tools and the resources that assist them in building the trust that they want to build with patients today. They're overworked. They're working long hours after they're actually seeing patients. They're spending a lot of time in the exam room, you know, just trying to take notes and understand what the patient's needs are. And I think that we would do better to focus not on pointing fingers at specific individuals, but rather focusing on the technology that will enable them to meet the needs of the patients. And so, with that backdrop, I think that there's a lot that can be done through a better provider experience and through a better patient experience that will drive better outcomes and lower the overall cost.
Fantastic. And maybe just pivot as a linking to a quick analysis that I've done, just looking at just to give you a perspective on how consumers are thinking about healthcare provision. So this is, you all be familiar with sites like uh, consumer affairs, for example, that allow you to go in, select any health insurance company, and you can see all of these different reviews. Well, what I find really interesting is I've just uploaded a range of healthcare providers, and interestingly, you can start to see the thematics that people as consumers are talking about. So you can see people are talking about membership communication issues, for example, being there
Mhm.
for 15 years, not getting communication, severe ER delays. So this is really the backdrop in terms of patient frustration, in terms of some of the key challenges that we talked about, simple, billing issues, for example, on unanswered calls and all the rest. And I know we're going to look at this in just a second, but thinking about the dollar value. So I've just run a
Mhm.
kind of revenue at risk model for one particular provider, and you can see that there's a whole range of issues, long waiting times on the communication, potential value at risk 48 million. So you can start to see that it's not just the technology, but actually the state of customer experience at the moment. And maybe just get a quick reaction to that in terms of how you see the current state of customer experience today, given that that is the big enabler that you're saying is going to transform. So do you think that the bar for good customer experience is low at the moment, or is it just an opportunity to use technology to kind of raise standards?
So I do not think that the bar is low in customer experience for healthcare. I think that people are demanding it. They do not they do not look at the customer experience compared to other healthcare companies. They look at the customer experience compared to other great experiences, and they think, why can't this happen with my insurance company? Why can't this happen with my doctor? Why can't this happen as I am just simply trying to navigate the health and well-being of my family and me? And so customers have come to expect it.
Mhm.
And that's where, I continue to sort of pound on the fact that there is technological innovation that has eclipsed so many other industries. Whether we're talking about AI or whether we're talking about, the digital opportunities that are available to us, at the click of a button. Um, when those technological innovations and declining costs collide with what consumers simply demand, which is simplicity and transparency, the at some point we're going to reach the top of the hill and we're going to go over, and I think that healthcare is there. Its customers are demanding it. And you and I will discuss a couple of examples of where there's a better way to measure the experience. There's easier and best practices ways to design the experience, and there's tried and true ways to engage consumers in their healthcare that will ultimately just improve the overall experience while at the same time driving better outcomes and lowering costs.
Super. And I think that's just such a wonderful summary, because what you've described is almost like the perfect storm, right? You've got stress being injected into the system by, old technology and systems and processes, overworked, unappreciated staff within the actual hospitals themselves. And then we're comparing the app and the interaction of an insurance company, Uber Eats, right? Hit a button and it arrives straight away. So that
Exactly.
consumerism of the experience enabled through technology is creating this pivot point that you're suggesting the best will punch through. So I'm wondering, is that a nice way to then link through to your next chapter, which is all about, well, how do we start to think about lifting the veil? So maybe if you want to uh, allow us to go there in terms of your thoughts, Paul.
Sure, absolutely. So here's what I will say. There are some amazing consumer healthcare products that are out there. And these companies are small, they're nimble, they're agile, and they are making some really, really incredible moves. And the question is, how do we elevate them, come alongside the health systems and the health insurance companies to improve that experience and ultimately lower costs? So I think about things like products that are solving a specific problem in healthcare. So number one, they are focused on the experience, but more than that, they are focused on a problem such as like diabetes, or they're focused on a problem such as postnatal care, or rural healthcare, and the challenges that that rural communities have as it relates to healthcare. Though there are companies out there that are solving those problems, and they're doing it in such a way by understanding what the customer and the patient and the members' needs are, and then building the product around those things. Now, you've also got um, uh, uh, larger health systems that have sort of have the legacy systems and have created sort of a little bit of a hairball as it relates to what the processes are and what the overall experience is, and they're also trying to improve that experience, sort of one pain point or one problem at a time. One of the things that I created was a framework, and it wasn't just me; it was a team of people that I had that really built an interesting discipline around best practices, because they started to focus on the experience as the product. And so I think I've got some sort of a model, maybe we could bring up. But this idea that the experience is the product, is where the focus is. How do we start to actually, create products around key journeys throughout a member's way that they navigate care? Key journeys are thought of as sort of like jobs to be done. Those ways that, I have a job in which, like, I need to sign up for healthcare. I need to sign up for my insurance company, or I need to schedule care. or I need to solve a problem with a payment. All of those are jobs to be done, and they're little mini journeys that members take. And if we treat them as products, now there's sort of a thing that we can actually start to create and form. And so it's not just about like the product itself, but it's about the way that we go about improving and continually creating, making that product better. And so it starts with just understanding what the customer needs are, right? Understanding really what's important. What are we actually trying to transform, or what are we trying to create? So if it's around the um, we're trying to create a better doctor visit, that's the product, right? And we use insights. We use as much insight as we can from consumers through asking them questions, but also through operational data to really truly understand what are we actually trying to do, and then we map that journey to make sure that we understand what the current state journey is before we kind of move to creating an entirely new journey, because we really do need to kind of be the experts of what is the existing process, and what do we want it to be, and what does the consumer want that experience to be.
Super. And I think it'd be useful just to pause, because that almost is a demarker in the first stage that you're suggesting, which is almost this as is stage before you would then take almost like a helicopter view to say, well, how do we disrupt or think about that? Just want to maybe
Right.
comment that I think the audience will really appreciate your thoughts and ideas around product, and also this idea of jobs to be done, because both I feel you've link them very naturally, because product delivers goals, job to be done, satisfies a goal and an outcome. So I think that's such a great way to think about that. Do you mind if we just peel back one or two layers on that just to get a bit more
Sure.
before we move on to the next section, please?
Sure. Well, let me give you an example of, and first of all, I would say that this is really about measuring the experience, right? This is about like understanding what our customers go through today, what understanding, as you said, jobs to be done. And one way that we measured the experience, there's a number of ways that you can measure the experience. Number one is, NPS. How likely are you to recommend? And that is a customer telling you how they feel about the experience that they just had, or the overall experience that they have. That's one. But when you start to uh, layer on operational data to that, you start to see things even a little bit different light. So one of the ways that we were measuring the call center was, you've got your typical measures like average handle time, service levels, a call, the time on hold before getting to a service agent. We started looking at it from a first of all, a first call resolution. It was one of our metrics, and it was, um, did the member get the job done that they were trying to get done on the first call? So were they getting their issue resolved on the first time that they called? And we were actually seeing that it was not a good metric. I mean, it was a good metric, but we weren't doing a good job. And we started to peel back and kind of try to understand. And I looked at, for example, Monday calls, and the Monday calls started to show us that they sounded a little bit like this. I'm just trying to log in and I can't. I've been trying to log in all weekend and it's not letting me. I need to update my password because the website is not allowing me to update my password. And we would have hundreds of calls on a Monday that were focused on logging in to the website. So when we started to look at that first call resolution, they were getting their issue resolved on the first call, but that's not the way that they looked at it. They were looking at it as, this is the second time or the third time that I've actually had to attempt to get my issue resolved. So we started measuring across 6 different channels, and we changed it from first call resolution to first contact resolution. And that changed everybody's perception. By the way, this was a compensation metric that the call center was bound on. So it was a compensation metric across the entire organization, but it was all on the shoulders of the call center until we started to measure across all of these different channels, and we were realizing that the uh, the um, the mobile app was a very low first contact resolution, and the web portal was a very low first contact resolution, where in actuality, the call center and live chat were very, very high first contact resolution. So you can see by measuring the experience and really understanding what the actual job to be done for the member is, then you can start to redesign it. So you treat it like a product to number one, measure it. Number one, understand what those jobs to be done actually are. And frankly, their job is not to log into the website. That's not a job. Their job is to try and resolve an issue, pay a claim, understand when their appointments are. Those are the things that they're trying to get done, not to log into the website. And so when we were able to open that up and sort of peel that back, we truly understood what the experience was, so that we could start to treat it like a product and transform it.
Super. I'm so glad I asked for that rich example. So thank you so much, Paul. And I think that simple process, that ability to prompt those questions from a jobs to be done and product perspective, will allow you to reframe what is actually trying to be accomplished, but then how do you realign the measure? So actually you were measuring potentially the wrong thing. As you said, it was six
Right.
big touch points before people got through. So I think that's really interesting. So once you get the as is state, is it time to move to the next stage, or do you suggest there's a linking piece between how you define success and think about, the potential reimagine or the catalyst for that new insight or change enabler that you'll generate from what the measurement shows?
I mean, I would say, when you truly start to understand what needs to transform, and you've mapped it with insights, which is what we had done, to understand that it wasn't the call was not the journey; it was actually the journey of something else, and they were trying to uh, they were experiencing different channels in that journey. And we learned that through the mapping of their journey and pulling in operational and insights data to that so that we could better understand. Then it is time to reimagine the journey. But it does start with, how are we going to measure what good looks like? What is it that we're going to actually measure next? And that's extremely important to everyone align on, what is that measurement that we are going to try to move? What are the key things that we're trying to do? So, one great example of this in reimagining the experience is virtual care. Um, you know, Virtual care, and there's a ton of virtual care companies out there that are doing really, really great things. And then the question is then, how do we integrate those really incredible products into the sort of end-to-end flow of what a patient is trying to do from an end-to-end experience. So in creating a virtual care experience, you want to start with, well, what do we want the end-to-end experience to look like, and what are the ultimate, like, very, very few measures that we want to actually try to move. So do we want to try to move um, uh, more virtual visits? Is that the measure? So, like, we want to increase the percentage of virtual interactions? Do we want to improve health outcomes? So it really goes back to kind of the quadruple aim. Like if we're trying to increase the number of virtual visits, well, we're trying to increase access to care, right? We're trying to make it as easy as possible for members to get care as possible. If we're trying to improve outcomes, it's a completely different product. So you want to make sure that you're identifying what that North Star metric is and align the whole organization onto that. So when we were building a virtual care product, as an example, we started with uh, the annual wellness visit, and so we discovered through our research that about 90% of what you do in an annual wellness visit could actually be done virtually. And so we started to look at the whole offering, the whole product of virtual care to say, what are some other things that we could actually, allow members to do through a virtual care experience? And so we looked at, a lot of different metrics that all aligned up to increasing the overall percentage of members who were getting their virtual care. And then we tried to identify, well, how many are going to order a lab kit to be shipped to their house so that they could do that thing in the comfort of their own home. How many will leverage asynchronous care so that I'm just sort of chatting with the doctor back and forth very simply? How many are actually going to do um, video visits? All of those things are kind of the mini metrics that we were trying to achieve to improve that North Star metric of increasing the percentage of virtual care among our members.
Superb. And I think a nice reference point is another Paul Long analogy in terms of this idea of light green metric money and the dark green metric money as well. So I think that, thinking about your exact example there, I think could we use that analogy to get people to get closer to what really matters when we're thinking about the measurement framework?
Absolutely, and I do have to give credit where credit is due. I learned about dark money and dark green money and light green money from Joe White from the University of St. Thomas,
Great.
but really what it stands to is, and this is where I think that uh, customer experience practitioners can get a little bit off the rails, and so I'm gonna kind of look in the mirror a minute, right? Because I think sometimes customer experience practitioners they sort of take a few different personas. One persona is the what I'll call the culture persona, and the culture persona is beating the culture drum, right? And sometimes it can sound like to the rest of the organization, it can sound like we suck, we suck, we suck, we suck, we suck, and we got to do better. But I believe that a customer experience professional needs to be rolling up their sleeves, designing that end-to-end experience, helping to create those North Star metrics. And those North Star metrics cannot be better NPS. The North Star metrics need to tie to a real outcome around increasing access to care, again, at the very highest level, right? Increasing access to care, driving better health outcomes, and lowering costs. So if I go back just briefly to the first contact resolution, right? That's a that's a really expensive proposition when we found out that members were on the website or on the mobile app and not able to get their job done, which ultimately drove a call. So when we fix the channel,
Yes.
we're lowering the cost of the call, and we're reducing the number of interactions that a member has to have. That is dark green money. Now, light green money is extremely important as well, and that is around um, brand perception. And that's where NPS can come in, or overall satisfaction, or customer effort, which is more of a like a stated, experiential, um, a stated experiential perception that the member has. So that dark green money, that's just one example of, maybe lowering costs, but that's very incremental. But when you can start to, if you can come up with an experience that is actually lowering the total cost of care, that's a much different proposition. One example I'd love to give briefly is a product which is simply a mat that members stand on. And that mat can detect the prevalence of foot ulcers 5 weeks before the foot ulcer will actually rupture. So, through remote patient monitoring, when a member stands on that mat and there is a detection of a foot ulcer, the company is able to get them connected to their doctor in a timely manner so that they can prevent the foot ulcer from rupturing and ultimately prevent diabetic foot amputations. Now, a foot amputation is about 100 grand
Yeah.
in the United States. So, through engaging customers to simply stand on the mat every single day,
Yes.
and providing a good experience in doing that, and
Mhm.
being transparent with the member who is standing on the mat, and delivering a better experience for providers
Mhm.
when you're getting a member to that provider, that entire end-to-end experience, or that product, um, ends up being an incredible, not only experience, but an incredible total cost of care play, that will literally change the life of people. By the way, diabetic foot amputation, mortality rate is about 50%. So
Oh my
50% of people who have a
God.
foot amputation ultimately will die within a year, of that foot amputation, because they could become more sedentary. So
Mhm.
think of
Yes.
the dark green money of $100,000, boy, the
Yeah.
light green money of absolutely, um, uh, supporting the life of some of our most vulnerable population, and
Mhm.
that's really, really exciting.
Yeah, and what a powerful idea and such a simple one. I'm thinking about the nudges that you can actually encourage from an experience perspective to nudge people to take such a small action that is preventative, that provides this new experience, and obviously saves lives ultimately. So I think thank you so much for sharing that. How do you create the space for reimagine, Paul? We talked about how
Mm,
busy the CX role is, the pressures that they're under. Where do you get the space to, or are some of the ways in which you have seen that done really successfully to almost take a step back, and also to engage the whole organization, right? Because part of this is breaking down the silos in the organization to kind of say, okay, we need this mat to connect to here, and this needs to send this information, all the rest. So how do you even
absolutely.
do that?
Yeah, it's a great question, and again, that goes back to the customer experience practitioner. Their role has evolved, to very much of an operational role. And so, if you think about what needs to get done to actually, create this end-to-end experience, it requires a product manager, right? Or an experience manager to actually navigate the entire organization cross-functionally, to bring the right people together. So this is not a side of desk kind of a role. So for the leaders out there who are thinking about you know uh, a stronger focus on customer experience, look, it's one of the quadruple aim of healthcare. So it cannot be side of desk. It has to be a strong leader that can navigate the entire organization. It must be a leader who has executive presence, and who understands product, who understands operations, who understands marketing and insights. You mentioned behavioral nudges, uh, understands behavioral psychology, and can build a high performing team to navigate across the organization to create those new and improved experiences. So I actually picture a canvas of things, right? So it's not only the jobs to be done, it is where are we going to get the data to improve the experience, or to understand what the current state experience is today. How are we going to leverage technology and tools today? So how are we going to leverage AI to create those nudges, and create better experiences as we go? How do we even know who the people are? What are they like? What are their personas? All of that kind of information plays into creating those better experiences. And so you asked about the space. How do you create the space? Um, like I said, it's a full-time job, and it's somebody that can really navigate the entire organization and understands what it will take, not only to design new and improved experiences, that new and improved experience, but all of the products and capabilities that are needed to support that new and improved experience. And if we don't have those products or capabilities to support this new and improved job to be done or new and improved experience, uh, where do we go get it? Do we build it? Do we buy it? Do we partner with another organization that can help us do it? Those are the things that an experienced officer must do, to almost like create the space, not find the space.
And I think it actually brings us back to the heart of what you've just talked about, this idea at the middle. It's about experience transformation. So what you said is actually CX, if elevated within the organization, if connected to the dark green money, is actually the transformational lever for the whole organization to deliver this new lifting the veil moment for the organization and to deliver on what you've just talked about. Just want to spend just the last couple of minutes. We're now in the final quarter here. If we think about this concept of adaptive execution, is this a kind of test and learn, and is that feeding into the feedback and all the rest? So just take us to the last stage. We've done the as is. We've taken a step above. We've now got the new jobs to be done. We've got our products out there. We're thinking about a reimagined experience. So how do we then kind of nudge this across the line to then deliver the transformation? So many projects get stuck in the expensive build without the delivery phase. So I'd love to kind of land the plane for us, Paul.
Perfect. Great. No, and where this works the best is through cross-functional teams that are working in an agile way. I had the privilege to pull agile out of technology and into the business, and bring technology with it, so that it wasn't sort of a vendor customer relationship, but actually everyone was on the same team. So technology, well, I have found that the technology organizations, they understand the customer experience a lot more than even some customer experience practitioners, or those that are sitting in the business. And so I brought technology into the business to create those scrum teams that were that test and learn that you were talking about, that were doing the ceremonies that they needed to do. And I shifted the mindset of the business to work in a more agile way, always focused on what the customer's needs were. And it created different relationships between technology and the business and operations and marketing and all of them, created those. We established those Scrum teams that we needed to in order to move faster, and adapt as we needed to. So it's not about a project that needs to get done. It's actually about an ever evolving product, which is the experience, and that's what deploying and equipping and executing on what we've decided needs to transform so that everybody is on the same team to deliver to that customer.
Yeah, I love that idea because that's, as you say, I think it goes back to the idea that you talked about operationalizing customer experience because you've just lifted what you described as ceremonies and all the rest. Within the idea of sprint, you've got your epics, you've got your backlog, you've got the constant understanding of the needs, but then you've got pair programming where you're working with others to get things done. And then there's also the definition of done, which is how have we deliver value for the organization. So I just love that you've taken a well-rehearsed and well-executed idea into this new era. And I think that gives CX practitioners maybe a vehicle to think about the operational implementation of this. So that's fantastic. So well, Paul, we're at the final stages. Maybe if we were to maybe take a deep breath and then pull back to say, well, what are the three key takeaways or for people to think about next 24 hours, next week, next month? How do they use this framework to start guiding their organizations, having those early conversations to think through that?
Well, I think one key takeaway is healthcare is at an inflection point, and the veil will be lifted. The technological innovation is already there. There is a demand to lower costs, and there's a massive demand for simplicity and transparency among consumers. And so that is the burning platform for customer experience practitioners, and they should be capitalizing on it today. But it starts with truly understanding what needs to transform. I would suggest focus on one experience, um, the experience of reducing diabetic foot ulcers as an example, right? What is some big problem that we can align increasing member access to care, driving better outcomes, while at the same time lowering costs? And then the experience is the fabric that will help to do all three of those things. And that's where you're getting at the quadruple aim. So understand, what needs to transform, creating a metric or several, but very concise metrics to know what good looks like, and how to measure success, and then organize a team to actually deliver on that success.
That's fantastic, and thank you so much. Could I maybe just reflect, Paul, that you've really provided some really thought-provoking frameworks today, and as a really true thought leader in this area, I want to thank you not only about your reflective approach to allowing people to access these ideas in a really, I thought, inviting way, nice analogies that invite people into the conversation. But I think what I've taken away is that you've given a really, what seems to be a simple framework, but obviously has provided a way for us to access this operational excellence. So I know Jennifer, who's commented there, is also saying, so insightful, loved hearing your take on CX and healthcare. So Paul, all I have to do is to thank you for your time. Thank our audience as well for joining us today, and we'll catch up very soon.
Wonderful. It's been a pleasure, Chris. Thanks, everybody.
Excellent. Thank you now. Take care now. Bye-bye.